everyone, and welcome. Thank you so much for joining us. I'm really excited about this webinar. It's something that I'm really passionate about myself, and really kind of, I don't know, combining modalities became very important for me, being able to treat and get real results with my own skin. In particular, the last couple of years, what I have noticed is obviously as you get older, and I think especially once you hit 35 and over, your skin issues or concerns become more what we call complicated and intricate. I have skin issues now that I never had before, or that little spot that I used to get, or that bit of pigmentation, sometimes with a normal facial or a couple of LEDs, they would go away after a couple of treatments. And unfortunately, that's not happening anymore. So I had to get myself really kind of a little bit more savvy and a little bit better myself at combining my own treatments. And it also opened me up to having great conversations with our salon partners and also really amazing therapists, and asking them, like, what's the best combination of modalities in your opinion to treat rosacea or acne rosacea or pigment or acne grade 3 or rejuvenation or lines and wrinkles. And these conversations are some of the best conversations I think I've ever had, and I love talking about it. So what I wanted to go through today is showcasing mostly what our salon partners have been able to achieve by combining modalities and really developing, complex skin programs to treat their clients' skin concerns. And yeah, some really impressive stuff. So I'm really excited to share that with you today. I guess before we kind of go into the actual combining of the modalities, it's really good to ask yourself, like, by doing this, like, what are the benefits of combining modality treatments? The obvious one is, well, obviously, we're obviously doing it so we can get better results for the client. But the other reason why we do it is obviously better results for a client means a happier client, and therefore a happier client means a long-term client, and a good relationship for you and with that client and with your business, and it means that that client will become a really important part of your business and your business profits and so on. But I want you to kind of really consider that it's really important for young therapists, I think, as well, to start really getting their head around at an early start, getting their head around the importance of combining modalities, especially to treat tricky situations or tricky skin conditions. Some of the skin issues that we see, like, we often start seeing now more complications in different layers of the skin. So what we do know is that, remember, the skin is this really complex organ with many, many layers. And we know that the skin is so diverse, it's complex, and it has very intricate structure. So the skin has many functions, as we all know, with many layers of working tissue. So it is with this kind of complexity of the skin in mind that it is, I guess, really easy to appreciate why using one modality to treat some of the most intricate skin conditions will not be enough to gain your optimum results. Okay, and that's because of all the different layers of working tissue in the skin, and certain concerns or issues or problems will arise in different layers of the skin. So you need them modalities or them treatments, them products that are going to really be able to work on all of them aspects and layers and structure of that skin for you to be able to achieve optimum results, right? So that's the whole kind of idea of why combining modalities is important, right? Because the skin will need it if you really want to work on all them layers. Combination treatment programs form the best long-term results. That's just what we know to be true. And they also provide you with, like, you know, after a facial, a typical facial, you know, your results, you're lucky if they last a few days. But when you combine modalities along with good home care and good internals, you can see results lasting months. And then they might need a maintenance treatment, you know, whether that's their facial or whatever. And I really recommend, by the way, that part of your combining modality programs within your clinic, we often forget to have that conversation up front about what does the maintenance program look like. You know, don't forget you've got your pre-treatment program, your corrective program, and then also your maintenance program. So them 3 programs are really important within the business. This is why a combination treatment programs form the best long-term results for your client's skin. Exploring which treatments can be safely combined for maximum results or for maximum success, but equally knowing how to avoid over treatments is also vital to avoid adverse skin reactions and also damage to the skin. It's really important that you get that balance right. You do not want to have any adverse reactions or damage to the skin. Absolutely. And so I believe if you keep the best approach and keep these 3 points in mind when you are looking at combining modalities within your business, you will be successful. So the first one is you must be progressive rather than aggressive. And what that really means is, you know, sometimes going too hard, you know, we get really excited about fixing clients' skin concerns very quickly because I think there is a lot of pressure on us to perform and to give the results, the desired results. So first of all, I would say to you, get really good in communication with your clients and very good at managing their expectations from the very first consultation, explaining to them that this is going to be a journey. So you don't want to push a skin that's not ready too soon, because what you can see, you might get some damage happening and also some adverse reactions. So being progressive, in other words, bringing them on that journey at the right steps and doing the treatments at the right time is really important. One of the best devices in our industry that is progressive and not aggressive is LED. So that's an example of a device, a light-based device that doesn't create trauma, but also will improve skin health. So things like that are just important to know. So that's the first thing, being progressive in your programs, not aggressive. The second thing to keep in mind when you're combining modalities, what's the best approach, is supporting the skin's natural health first and foremost. You cannot begin to use corrective modalities, ingredients, treatments on a skin that is not healthy. In other words, looking at the condition and the water content in the skin is so important. So if that skin needs nutrition first, you must improve the skin health first and foremost and support that skin health throughout your package and program. And step 3, boost the skin's capacity for healing and regeneration, or we call them booster treatments. So you want to strengthen the skin so that when you do an advanced peel or an advanced needling session, that it has the capability to be able to heal and regenerate after having that trauma. So this combination will determine the positivity of your treatment outcome. And that's really important. We want positive treatments and positive results with minimum downtime. We don't want people, you know, struggling to recover after having a combined modality treatment. They should bounce back quicker. That's the whole point of combining modalities, is you'll see bigger, better results and faster recovery. That's the whole purpose of combining modalities, right? Now, what I want to really do is kind of take you on a bit of a journey too. Like, let's have a look now at some of what I believe are the best before and after photos collected by our PBS salon partners. I think we've got the best therapists and salons in the industry, when I see the results that they're able to get combining modalities, it gets me excited. So let's get started. I'm going to first kind of start with big brands, obviously, and a lot of combinations in these treatments. But we've got Dermalux LED. What makes kind of Dermalux LED unique is the ability of having three clinically proven wavelengths in the one head. So for those of you that don't have Dermalux, not all LED is the same. You really need to look at near infrared. That's 813 nanometer. That's the key, I think, within the combining modalities with Dermalux, is that wavelength is really important. And also then you've got red at 633 and you have blue at 415. So it's a medical device, Dermalux. And then you'll see a lot of our MesoPen or EPN, which is a skin needling device. What makes that device unique is it's currently the only needling pen in Australia that also has what we call electroporation. So it comes with a separate tip or a needle-free tip that can infuse mesotherapy solutions like fusion mesotherapy, medicine skincare. It'll do transdermal deliveries, meaning delivering that active ingredient right into the site of pathology. So where the condition is actually occurring. That's really important for great results. And so what MesoPen do, so it doesn't just do your electroporation on its own, it'll do skin needling on its own. But my favorite treatment is that it will do what we call fractional mesotherapy. And that is your physical collagen induction therapy with using your needles, combined with electroporation, which is electrical pulsing. And what that does is pushes them products deeper into the skin, and it'll increase your results of normal skin needling by several 100%. So it's kind of like needling on steroids. It's really progressive. Not aggressive, right? Progressive. And then you've got Fusion Mesotherapy. Fusion specialize in advanced meso formulas for skin needling and other infusion devices. Superior results and superior quality ingredients. Then you have Image Skincare. You know, Image is, I've been using Image for 8 years now, and it still blows my mind how good our peels are, and our cosmeceuticals, our home care, our post-care products. What makes Image, I think, one of the best kind of ranges to have in a salon if you have modalities and you're very serious about combining modalities, or very serious about offering good skin programs to treat intricate conditions. I think one of the most important things you need to have is a awesome skincare range that can support them modalities. In other words, pre-treatment programs, strengthening skins using good cosmeceuticals, and then being able to take care of them skins in between your treatments. You really need to make sure you've got a good skincare range and a good partner to be able to do that for you. And if you are on the hunt for a good cosmeceutical, I cannot recommend Image Skincare enough. It's superior, and it has over 10 clinical peels to treat all conditions in there. Some are superficial, you can do medium depth and advanced. So you've got everything covered there. And then we have Bestow. Bestow is a dermal nutrition range that's designed to treat conditions from within, or feed the skin from within. So what you're seeing here is you're seeing topical skincare, you're seeing modalities, and you're seeing internals. And they tend to be, when you combine all of them things together, that's when you'll truly see skin transformational results. Here's an example. So this particular client was from Face Mediskin. They obviously did an observe analysis first. So the minute you can see on that first treatment there, this first picture, look at the inflammation. You've got massive dehydration, you've got sun damage, pigmentation. And what they did was, first of all, they thought, well, we've got to remove the inflammation first. So they started off with Dermalux. They did 3 LED sessions per week for 10 weeks. That's the secret to strengthen and pre-treat a skin, getting it ready for peels. They did, and needling. They did 4 needling sessions with the MesoPen and Fusion. And that treatment is called Fractional Mesotherapy, combining your electroporation with your collagen induction, so your needling. What I love about the girls, and they're so good at this, is they did exactly what I would always recommend. Before you start, so you choose your cocktail with our meso, depending on what you're trying to treat. But too often we see the problem. So too often we'll see a client come to us and say, I'm really concerned about my pigmentation or my wrinkles. And we know that we need kind of, more active or corrective ingredients to treat that. But what if that client comes to you and her overall skin health isn't good? It's not there. We need to feed and nourish the skin first. So Fusion are very clever. They have a cocktail called XFC Plus. You'll see it here. XFC Plus has got more nutritional ingredients than any cocktail I've ever worked with. It's got over 18 different vitamins, over 6+ coenzymes. It has massive anti-inflammatories in there and epidermal growth factors, which are designed to strengthen them surface layers of the skin and provide protection as well as nutrition and balance. And interesting enough, it's got an ingredient in it that also stimulates the ATP. So it's working along with your LED to really increase cell metabolism. So getting the skin fit and healthy is basically what it's trying to do. And it does it so well. So often we'll start off with a cocktail like that to boost the skin's health. Because when we do that, the next cocktail, which they did next, was what we call F-Meso Matrix. F-Meso Matrix focuses mostly on fibroblast growth factors and stimulating that collagen type 1 synthesis, which is really important for them fine lines and wrinkles. But it's like you can't produce good collagen if your skin cells are unhealthy, right? So that was a brilliant combination from the girls at Face Medi Skin. They did an excellent job at figuring that out. This is a very undernourished skin here. You can see there's a multitude of problems. It has a lot of environmental stress. So treating a skin like that, LED is the perfect combination and good products that are going to add nutritional feeding that skin cell before we start to photocopy it, before we start to get it to turn over. So an excellent home care plan here as well. Skins like this need a little bit of retinol. Interesting enough, they put this client on a small dose of retinol, which would be for your sensitive skins. They did it in an overnight mask. They provided a cleanser, which was the key here as well. This cleanser was designed to balance the skin's pH, bring it back to between 4.5 and 5.5. So making it more that neutral and increasing her water levels and moisture levels very quickly, that cleanser. And then obviously SPF is key. So 3 simple products, lots of LED and 4 skin, what we call fractional mesotherapy. I think this is a great result. Here's another example of using internals with LED and skin needling. This includes your image peels, which I loved. So what we have in here is the Hermetic lift with the signature lift. So all of these is really superficial peels. And interesting enough, we didn't really need to go deep with this client because she's quite young. But what you can see here is we've got post-inflammatory hyperpigment from her breakouts. And you've got a little bit of pigmentation on the cheeks, a little bit of sun damage, but it's very superficial, a bit unbalanced. I would say a little dehydrated on the forehead, a lot of dehydration on the forehead and around the eye area there as well. So really good combination is, first of all, they would have put her on at home skincare, which was the intense brightening serum from Image. What you have to understand with the products when you're going to peel is you need to have a good balance of AHA and BHA in there, ideally, something like that in their home care. And we would prep a skin like this about 2 weeks before we would start peeling or using needling or other modalities. So you want them, if they're Fitzpatrick 1, 2, or 3, I would say 2 weeks prep on good home care. That home care needs to be AHAs, BHAs, tyrosinase inhibitors, antioxidants as well, ideally SPF. And then other things that are beneficial are retinol, but it's not a must, but retinol can really get the skin ready for peels as well. And then if you're Fitzpatrick 4 and above, the prepping products, you need to be on a little bit longer, obviously. We would say about 4 weeks minimum, 4 to 6 weeks, depending on the client. And what they also included here was her Bestow Beauty Plus oil. For those of you that haven't got Bestow or aren't using a dermal nutrition product, do not underestimate what taking care of your gut health can do for improving your skin. Our Beauty Plus oil from Bestow is high in omega-3 and omega-6. It uses golden flaxseed oil. But it's actually, and it's got lots of other ingredients like blackcurrant oil, there's lots in there, but it's designed to eliminate the blockages within the gut and in the skin, so that the skin can start to detox, but also it will help the skin it'll naturally moisturize it and also help with sebaceous activity. So don't forget the internals. I think internals, you will truly see proper transformation when you include internals. And then they also did our AC and N with the cocktail with needling. So again, they did some peels with LED. So they did 4 peels in total, 4 LED treatments. And then they did their first fractional mesotherapy with an AC&N cocktail from Fusion. An AC&N is a cocktail that targets acne. And it has a little bit of retinol in there as well to help speed up that cell turnover, shed off that kind of bit of sun damage she had in the epidermis is gone now. But look how happy that client is. That was a really great result. Again, here we have, in this one, what we've got is Dermalux image skincare being used and fractional mesotherapy with the product called Fusion Mesotherapy. So to my knowledge, this client was from Revive Skin Studio. And I really have to commend this lady because this client came to her, to my knowledge, that had already had needling previously done with a non-PBS salon, did not see good results. In fact, she was left with all of these bumps on her skin. So this particular therapist, first of all, got her on really good home care. So you can see she added lots of vitamin C into her home care from Image. She had SPF in there. She had a little bit of AHA and BHA, which is in the total resurfacing mask. The AHAs and BHAs really start to get the skin used to having them actives and corrective ingredients. They help to speed up that cell turnover and refine the epidermis. And that's really important. And it can really aid in the results of needling. You tend to respond so much better when you are getting rid of a lot of that congestion through a peel and then do your needling afterwards or through your skincare. So this ageless resurfacing mask from Image combines actually salicylic, lactic, and glycolic acid. It's a 17% in total, but it's a brilliant take-home product, and you would use that about 2 or 3 times a week. It acts like a mini peel at home. So it was a really smart idea to include this. And then they did 2 needling treatments with AC&N, which are to treat acne. So that would have controlled the P. acne bacteria in the skin. And then they did 5 further treatments with Mesomatrix. And Mesomatrix uses a lot of fibroblast growth factors to strengthen up the dermis and refine that epidermis. But really, she would have got a lot of good collagen or a lot of restructuring of that dermis there. But they didn't move on to that until they kind of cleared up the congestion first, which I thought was really clever and well done. And they also included Dermalux LED in there as well. The other thing is, I don't know how many LED sessions, but I'm guessing it was quite a few. Someone like this, I would have done 6 at a minimum, but generally 12 treatments. And then some combinations with Mesopen, Dermalux LED, Fusion, and Bestow. So this lady here, another great picture from O'Hara Skin and Body Clinic. Erin incorporated our Mesopen Pro, which is our skin needling device with electroporation. She used Fusion cocktails. She did an Image peel, and then also her internals with Bestow Beauty, which is a really good plan. So she started off with her internal nutrition on the Beauty Plus oil plus the collagen boost. So again, the Beauty Plus oil eliminates the blockages. It's like an internal moisturizer. Your collagen boost obviously helps to feed and nourish the skin. And as you can see with this skin, it had a lot of environmental stress, so they definitely needed that boost internally. Great home care plan as well. They've got them on a good cleanser to balance the pH. We've got MD SPF in here. You have lots of vitamin C and antioxidants because this skin needs a lot of nutrition, which will help to repair itself at nighttime. And good Illumat facial illuminator serum, what I love about that is it has your tyrosinase inhibitors, encapsulated glycolic, so you get natural cell turnover and good exfoliation with that, as well as your anti-inflammatories. So really good combination there. I have to commend Erin on that. That home care plan was excellent. And then they did a signature facelift to start in the treatment protocol. The signature facelift combines a 30% vitamin C, enzymes, and hyaluronic acid peel. It is so good at minimizing redness and hydration and increasing hydration levels, that peel. And then they went in and they did 4 Mesopen Pro treatments using the Radiance cocktail from Fusion. And in that cocktail from Fusion, that Radiance, it works, its targeted tissue in Radiance is actually your epidermis, and your targeted cell is that melanocyte. So it works at regulating the melanocyte so it doesn't overproduce, and it also helps to decrease tyrosinase activity. It's a really clever cocktail. And then they also did some glow lift. So once they kind of worked on the epidermis, which I thought was ingenious, they started going a little bit deeper with the glow lift. Glow lift mostly targets your superficial dermis, and even your medium dermis. And it has a lot of fibroblast growth factors in there. It has ingredients that work at working on what we call your glycation within the skin, which is that aging process that, that you get a lot of cross-hatching and things like that from that type of aging. So a really good combination of treatments there, really impressive results as well. Excellent. She looks like she got a facelift. Look, the periorbital wrinkles are pretty much gone. You can see a nice lift here as well. If you zone in, there's like a little bit of a lift there as well on that cheek. The nasolabial fold here looks like it's completely lifted. Pigmentation is so much more even. You've got a lot of spots there. Overall texture of the surface of the skin, we've gone from seeing visible pores to beautiful smooth texture. Really great results. Now, I'm really glad that I really wanted to include Youngblood Mineral Cosmetics in the combination therapies. Because I think we've kind of somehow, I feel like a lot of people have stopped focusing on the recommendation of makeup. Sometimes we get so into the more high performance modalities that we forget about what pore clogging cosmetics can do to our treatments. I see it quite often with pore clogging cosmetics, people using their pore makeup before and after peels, and seeing a lot of hyperpigmentation coming through on the skin, sensitivity coming through on the skin. So I cannot emphasize enough how you can transform someone's skin by getting them on a good mineral makeup, especially if they have inflammatory issues and if they have acne. Even with my cousin, all I did was, she had a full face of acne grade, I would say 3. All I changed was her foundation and her primer, and changed her onto Youngblood because she was on a mixture of MAC and lots of other things. But and just from doing that alone, you could completely see her skin heal. Because remember, good mineral makeup will allow the skin to breathe and heal. And it's designed for post-operative and post-procedure. Youngblood is. It will give the skin the right ingredients to allow it to oxygenate itself and heal, and also conceal. That's what we're trying to do. So just don't forget about the makeup recommendation, because you can be doing all the hard work and then they're going home putting on pore clogging cosmetics. We don't want that. So some great results with this. This is Dermalux LED with some Image skincare peels and Youngblood Mineral Cosmetics. So what this client did, they did 2 LED treatments per week for 6 weeks. So that was 12 in total. Perfect program. We always recommend 12 LEDs if you can do it. And that will strengthen the skin. The key with LED before you're peeling, you want them to have as much as near-infrared and red in combination together, because that will increase ATP levels. It'll strengthen the skin. When you do near-infrared and red together, the two of them combined are better at that than any other wavelengths combined. And I think it's Dermalux's ability to be able to combine near-infrared with any other wavelengths that we will see faster results because of the combination of them two. And then they did 3 oxygen lifts, which I thought was a very clever choice because O2 will, you can see this skin is really dull. It needs oxygen, and bacteria doesn't like oxygen. Remember that. So skins like this need a lot of oxygen. And then they did 2 salicylic peels and then 1 mandelic. And salicylic is so good at, declogging. It works from the top down. It gets through all that oil, that grease, that dirt, and clears out that pore really well. And then obviously making sure the client is on 100% high quality professional mineral makeup so that the skin can continue to breathe afterwards. So that was a brilliant combination. Look at the color of the skin. It's really remarkable. Another great one as well. So this was changing young blood. What I loved about this was 2 LED treatments for 4 weeks. So that was 8 LEDs in total with an oxygen treatment from Image. And then just an enzymatic peel, which is a 30%, this one, 30% vitamin C and enzymatic peel. What you can really see here is obviously the color and the clarity is good. What you can see, the shine on the forehead is gone, so her skin is more balanced. She's not overproducing oil. Her skin is breathing again. The congestion has gone down. You've got closed and open comedowns along the forehead there and in the hairline. Massive improvement there. You also even had very dehydrated cheeks. You can see a little bit of flaking there, dehydration. So oily tea, dehydrated cheeks, completely undernourished and unbalanced this skin was. Beautiful results in combination therapy. I love this one as well. Very smart. They did 2 LED treatments. This was from my cosmetic studio. They did 2 LEDs per week for 4 weeks, and they did red and near infrared. And again, that's the game changer, having red and near infrared combined, because it will increase ATP levels quicker than anything else. And we know that ATP is that adenosine triphosphate, which will increase cell energy, which we really want to strengthen the skin. And you'll remember at the beginning, I said, what are things that you really need to consider when you're combining modalities is strengthening that skin before you hit it with, other procedures, because we don't want adverse reactions, right? And a healthy skin is resilient. How do we do that? We hit it with red and near infrared. So before needling or before peels, combination of red and near infrared or IPL in this case, perfect, really good. And then they did 2 O2 lifts to oxygenate the skin, oxygenate that tissue, improve healing. So the skin was probably healed up because we had a lot of inflammation. We've got pigmentation here. It's dry, it's dehydrated. There's a lot of environmental damage on this skin. It's also undernourished. There's no water content in there. Periorbital wrinkles, you can see that nasolabial folds quite dropped down. So there's a lot going on with this skin. So they did 2 oxygen lifts, get the skin healing and in good condition before they did their IPL. And then they did this beautiful light 2 IPL skin rejuve. So that would have cleaned up all the pigmentation spots as well as the vascular. You've got a lot of little broken capillaries around here. And a little bit of scarring as well, a little bit of post-inflammatory hyperpigment, and that is gone. Like, excellent results. And then obviously they changed her makeup because you can see she's got a lot of underneath congestion here. Along with all that dryness, you've got comedones and even milia you can see along there. So that was a brilliant result as well. Excellent results there. This one was combining your Image, Bestow, and your LEDs. What they did here, now this is a tough skin, an acneic skin that needed a lot of detoxification and a lot of home care. I think prepping is really key with a skin like this. And what they did is they put her on our Gut Love powder internally. And Gut Love is a powder. It's a superfood, basically. That's what Bestow consists of. It's organic foods. And they're powder forms. You put them into your smoothie daily, and you take your smoothie daily. And you also have oils. But the Gut Love powder is incredible at detoxifying your gut, because when you generally have acne, it's really can be connected with digestion. So, so Gut Love will not just detoxify the gut, it will detoxify the skin, and it will also help with removing inflammation in the gut and therefore removing inflammation in the skin. So really good combination internally. It also has a lot of zinc. It's got your daily dose of zinc in there, which will help with healing in the skin. So really important to affect that internally. And then they have a brilliant home care plan in there, max cleanser, a serum that's going to add vitamin C, so it'll boost the skin, but it'll also remove inflammation and heal any scarring. And then they've got retinol in the nighttime mask. Adding retinol to acneic skin is so good because remember, retinol will help to kill bacteria as well and speed up cell turnover, so to increase natural exfoliation and regeneration. And then you've got 14 express image peels. This salon did a great job at combining level 1, level 2, and level 3 peels, or we say superficial, medium, depth, and deep peels. And they brought her on an excellent peel journey. Yeah, there's nothing to say. The results speak for themselves. So that was a really good result. Then we have peels and LED. I love this. They did a few peels and LED, but they also included Bestow as an internal. So they did 12 LED treatments, massive inflammation. This is a very, very sore looking skin. I was going to say sad, but it's definitely sore looking. So massive inflammation, lots of surface dehydration there as well, post-inflammatory hyperpigment, and scarring, a lot of scarring. They did 4 facials a week, which consisted of, I should say, peels, Signature Lift, which is a superficial peel, Acne Lift, which is salicylic and glycolic, and then the Lightning Lift is a combination of kojic acid with lactic to remove redness and pigmentation. So they kind of nailed it there with that combination of peels. At home care, really good home care plan, again, including SPF, tyrosinase inhibitors, anti-inflammatories, replacing the pH and balance and moisture levels of the skin. So and full of antioxidants and a little bit of retinol at nighttime. Like you couldn't get a better home care routine than this again. And including your dermal nutrition, the Beauty Bestow oil to help eliminate any blockages and moisturize that skin from the inside out. What I also might not have mentioned, remember the Beauty Plus oil in Bestow is also designed to regulate your oil production. So if you're unbalanced, meaning you're producing too much oil or not enough, it is the best way to treat the skin from within in that sense. So brilliant for acne as well as oily. That's what I'm getting at. Really good for them skins. Again, another one that included internals with LED and peels, and then your home care and your cosmeceutical. So 12 LEDs with this one. Again, beautiful results. Again, we've got a lot of hormonal activity here and a little bit of pitting and scarring there. And that consisted of a Signature Lift, which is to treat your redness and hydration. And then your Lightning Lift, which is kojic and lactic. And then a combination of a little bit of glycolic and salicylic as well to help resurface and decongest them pores. Absolutely brilliant. And then the Beauty Plus oil from treating that internally, eliminating blockages internally within the gut as well. Really great results on that one too. Now this focuses mostly on our Mesopen, which is our skin needling device or collagen induction therapy, which also does fractional mesotherapy and needle-free mesotherapy, so a needle-free option. With the Fusion use sterile cocktails. Remember, they've got a cocktail to target every condition, and then your image peels. So great combinations here. This is an image skincare at home, Mesopen skin needling, and then Fusion cocktails in that needling device with that needling device. So they started off on a really good home care plan. You've got the Vital C anti-aging serum, SPF and prevention mat. They have a Clear Cell medicated acne lotion, which, because you can see this client's got a lot of pustule, a lot of bacteria in the skin here. That Clear Cell contains a tiny small percentage of benzoyl, which helps to eliminate all that P. acne bacteria and kill that in the area. So it's a great on-the-spot treatment. They've got hydrating mask included to target that overall health. A little bit of retinol as well to speed up cell turnover, collagen build and strengthen that skin. And then with the needling, what they did was combined, after they've done the peels for acne and beta lift, which are salicylic peels. So they would have cleared out all that epidermis first, then they started to needle. And I think that's the key, is the way that they cleaned up that epidermis really well, because you can't needle the skin like this, by the way, that has bacteria. So you want to combine them peels that will clean that skin out, get rid of the bacteria first, and then you can needle away. Unless you do a needle-free option. You can use Fusion AC and N, by the way, with a needle-free option, which is infusion, as well as with a needle. So you can use it both ways. That's the beautiful thing about the Fusion cocktails. Their ACN cocktail is incredible. It's got ingredients that will kill P. acne bacteria, that have anti-inflammatories. It's got epidermal growth factors, as well as a little bit of retinol to help speed up cell turnover. Great results. Here's another one, again, with Image Skincare Fusion Mesotherapy and MesoPen Pro, which is your skin needling device. This was after 2 balancing lifts, 2 perfection lifts, and then 2 LED or 2 skin needling treatments. And again, their home care is SPF and a little bit of retinol at nighttime. Great results there. Again, this is with our Image Skincare Fusion Mesotherapy and our MesoPen Pro. This is from O'Hara Skin Clinic as well. So they did 6 skin needling treatments, and they alternated between Fusion's Mesomatrix and Venistim. Interesting enough, the Venistim is one of the newest additions to the Fusion Mesotherapy range, and I love it as an acne rosacea sufferer myself. The Venistim treats rosacea, cuperous, telangiectasia, and really high redness in the skin. So great anti-inflammatory, and it actually stops the formation of that hardening of your veins and capillary walls. Brilliant. And then they also used Mesomatrix, is the best for treating scar tissue, because it will restructure the dermis, increase your collagen type 1 synthesis. It's brilliant at that. And then the home care was ingenious, a little bit of benzoyl with that acne lotion, which will help clear up all the bacteria. A little bit of salicylic in the Clear Cell Tonic to help decongest the skin, and then a really good SPF. Very simple, but really nails it there, and great results on that skin. Here's another one with peels and needling and Image Home Care plan. I don't have the details on that, but my God, this was so impressive. Look at the pitting and the scarring. And again, this is down to combination of peels and needling with the Mesomatrix Fusion cocktail. Mesomatrix, by the way, is amazing, not just at scar tissue, but at cellulite, at stretch marks, and really, really deep lines when you need to pop up that skin. It's brilliant at that. So I'm loving the results here. This one is a tough one as well. We have a big scarring and an old scarring there as well. So this was a combination of Image Skincare, Fusion Mesotherapy, and doing the Fractional Mesotherapy. So really detailed home care plan with this one. Lots of antioxidants, retinol, again, you know, SPF, they've nailed it. Lots of vitamin C, everything the client needed, tyrosinase inhibitors, AHAs and BHAs, peptides, they nailed it. So look at the overall skin health there, it's excellent. And they use the Mesomatrix cocktail again, which restructures that dermis. So really good combination of treatments there. This is a brilliant photo. Simply Divine Beauty did this, and wow, that is like a new person. They took off 10 years, at least I would say 15 years. And what they started off with was Image Skincare peels, which were 30% superficial vitamin C and enzymatic peel. And then they did 2 micro needling treatments with a Fusion cocktail. I'd love to know what that cocktail was. I might have to come back to that, but I think it was Mesomatrix from my knowledge. Brilliant results there. And again, using Fusion and LED. I wanted to just show really case LED. LED is one of them treatments that is so progressive without being aggressive, and it's so vital in combination with more invasive technologies like IPL or needling or lasers. And the reason for that is because it's the best light-based device in our industry at really strengthening the skin. So you can just see how dry, dehydrated, inflamed, you know, this skin is so unhealthy. But look, after 10 LED sessions, that was 1 a week. Look at the hydration, the lines are you know, improving. So it's amazing how LED can really improve the healing of the skin. This is a combination of LED combined with fusion mesotherapy, and obviously our fractional mesotherapy, which is combining transdermal delivery with collagen induction therapy, which is your needling combined. So great results, and on a really high Fitzpatrick as well. So, you know, don't be afraid to treat them high Fitzpatricks. It's fine to treat them once you've prepared the skin properly. And again, some great results here. I love this. Look how oily that skin is. Yeah, some great results. So this was a combination of this Bestow internally, so our Beauty Plus oil. And then they've included a really good at-home skincare plan with Image. So they would have had tyrosinase inhibitors in here, some AHAs. They have done 4 oxygen facials or peels, 2 papaya peels, and then 2 vitamin C peels, pretty much. And then 1 skin needling with fusion mesotherapy. Fantastic results there. Oh, I'm going the other way. Here we go. Love this. This is a course of LED combined with needling. And so they did 3 Meso Pen Pro, which is fractional mesotherapy again, with Dermalux in near infrared. Near infrared at 830 nanometers, which really works at increasing repair and regeneration in the skin. So near infrared is incredible at doing that. Some great results here. Again, LED and skin needling, it's a no-brainer. Look, I often get asked, when should you include LED with needling? Absolutely, you've got to do it before. I think always before, and I would do, you know, a booster of at least 4 treatments before my first needling session. I would do, you know, 2 on week 1, 2 LEDs on week 1, 2 LEDs on week 2, and then on week 3, I would start my first needling session generally. Unless that skin is very unhealthy, you might need to do maybe 6 LEDs before, but that will depend on the client and the condition that you're treating. And before needling the skin, I will always include red and near infrared to increase that mitochondria activity and increase ATP levels. Directly post needling, I'll always do a 10-minute near infrared at 830 nanometers. And sometimes I'll include blue. On a skin like this, I would definitely do blue and near infrared post to minimize breakout post needling. You would leave off red light post needling until all the inflammation is gone from the skin. So you might be introducing red and near infrared again, maybe on week 2, roughly. It depends on the client and how quickly they recover. But some really great, this is one on the hair, F-Hair Men. I love this. So that was 1 treatment a week for 10 weeks. Like, he's a new head of hair. This is incredible results from the Skin Studio. Really, really impressive treatments. They've got their needle depth on there, really great. 1 treatment of needling with our Meso Pen Pro, but the key is the Fusion cocktail. Fusion is obviously a meso formula that can really, you know, apply that medicine skincare right into the site of pathology. So great results there. This is just 1 treatment with the eye contour and using electroporation or fusion with the Fusion cocktail. Really great results after 1 treatment. Again, this is doing skin needling with Fusion Meso Matrix, which is obviously that cocktail, but look at them periorbital wrinkles, they're gone. Beautiful results on the nasolabial fold as well. We've got a bit of a lift here. Really incredible results. Overall clarity and color is brighter on the skin. Here's another great one, is again around that eye area and the forehead. Really, even inflammation has gone down. They use the Fusion XFC Plus, which is adding nutrition, really feeding that skin. Again, another great one with the XFC Plus cocktail. I love this. This is a great result. It's only after having 2 sessions with skin needling, doing fractional mesotherapy combined with Fusion cocktail. And they did them 4 weeks apart. She's quite young, but she bounced back so good. Look at the color and the hydration. And then LED with peels and some microdermabrasion. So a good at Image home care cosmeceuticals at home, and then 6 LED treatments in combination with 3 micros. Really great results there as well. Look at the refined texture of that skin. Some great treatments there. Near infrared and red combined is the key on a rejuvenated skin when you want to do rejuvenation like this. Peels and LED, so they did 6 peels in total, or no, sorry, 2, 4, 6, 7, 8 peels in total with this one. High Fitzpatrick, so don't be, if you have a high Fitzpatrick, once you prep that skin really well 4 weeks prior, you will see absolutely incredible results. And in combination with LED, you're guaranteed to strengthen the skin. With a good home care plan, LED first and then start peeling, you'll be guaranteed to see results. Peels and mesotherapy at home, look at that, absolutely brilliant. They combined our Medic Lift. Our Medic Lift is an organic peel, by the way, and it's safe for even pregnancy. So you see great results on breakout, congestion and redness in the skin. And then they did Mesomatrix again, which is a lot of scarring with this, so it goes quite deep. Your targeted tissue is kind of medium dermis, or even, you know, a bit deeper if you need to. So great results with that one. And then just even doing LED with Bestow, look what you can do, like combining your internal nutrition with that light-based device modality. Excellent results. This was a 2 weekly Dermalux treatments for 1 month, and then monthly maintenance. They included the Beauty Plus oil, which eliminates your blockages, right? And it's like that inside moisturizer, regulating sebaceous activity, so you're not overproducing oil. Then you have the Very Beautiful powder, which is an antioxidant. Remember, with acne skins, smokers, skins that are a little bit older, and stress skins, they will always need antioxidants added to their diet and their home care plan. So the Very Beautiful powder is basically full of every antioxidant superfood you can think of. And then your Be Cleansed powder includes zinc and slippery elm, things that will detoxify that gut and remove inflammation. Really great combination here. At home skincare, God, that is sometimes, that's a great, all you need sometimes is a good at home care plan, and then a couple of peels in clinic. They have Bestow in there as well. So an internal at home care plan and a peel, great results. A peel and some internals as well, Beauty Plus oil. And then, you know, I wasn't going to put in just LED, but what I think if you could combine any modality, if you could combine one modality with anything, what would it be? It has to be LED, because LED uniquely can treat, it can pre-treat a skin, in other words, get the skin ready for invasive procedures. It can correct, meaning it can actually fix problems, correct them. And it can also be used as a maintenance. So if you're not really considering, is my LED being used in all elements of my business to pre-treat, to correct, and to maintain, make sure you're utilizing and getting the most out of your LED, because you can really see proper transformation and longer lasting results when you're combining it with other modalities. That's the key. So just look at LED alone. That's 12 treatments. Completely different skin, color, inflammation, congestion's gone down. Great results on overall pigments and hydration, overall rejuve after just 2 LED sessions. Great for healing. Remember, it's the best at improving healing. That's just on an acne skin after having 3 with blue and near infrared combined. So blue and near infrared on the skin at the same time. Great results. Look at that healing. Impeccable. Really great healing. Happy, happy clients. Look at that scar. You can barely see it. Look at the décolletage. Look at that damage, sun damage. I think people forget how good LED is at improving the health, but also the color and the texture and the tone of the skin. It's so good, strengthening that skin. That is it, really. Thank you so much for listening. Again, if any of you are interested in any of the products, or just, even if you're not interested in the products, but you're just wanting to know how you can even get the most out of your own modalities and what you currently have in your clinic, reach out to your BDM. You know, have that conversation, like what could I do with what I have to treat pigment or acne? You know, we all have we all get tricky clients that we just scratch our head about sometimes, and we're like, I don't know what to do here, this isn't working. Go onto our PBS Skin page, share your questions. We are here to support you and help you with that, and maybe help you create some really cool modality packages within your own business. Thank you again so much for watching. And if you've got any questions, shout out to us anytime. You can call us at head office on our 1-800 number, which is 625-387, or just reach out to your BDM. They'll look after you. Thank you. Take care. Bye.